I just got off the phone with a patient who sustained a concussion earlier this year, and she's been seeing a vestibular rehab provider, but she mentioned that all of the exercises that she's told to perform make her feel way worse. I get this call fairly often, and so I wanted to make a video to address it. When performing rehab, vestibular rehab specifically, just because that's what the majority of my day consists of, there are three different approaches, which include rehabilitation, compensation, and habituation. Let's explore the differences between these approaches and how they can each be used to treat someone who has sustained a concussion. First up, we have rehabilitation. This is always, always, always my preference when it comes to working with a concussion patient, if possible. I want to emphasize that, if possible, and hopefully you'll understand why as we continue throughout this video. Rehabilitation refers to the process of restoring or improving the function of a faulty system through targeted exercises with the intention of rehabilitating that system. When utilizing a rehabilitative model, my intentions are first off dependent on a thorough examination of the patient in front of me in order to isolate the areas of their brain that are faulty and then perform specific targeted exercises to increase the integrity within those faulty regions. And if I've done my job correctly of locating that faulty region and perform targeted exercises for that region, you as the patient should notice continuous improvements. I don't think the age-old saying things have got to get worse before they get better necessarily have to apply to brain-based rehab. Compensation is another approach that we have at our disposal, and it involves teaching the brain to rely on other sensory inputs, such as vision and proprioception, to compensate for the loss or the impairment of the vestibular system, for example. Without getting into the nitty-gritty of the vestibular system, if you'd like to do that, I have other videos for you. But just to keep this one real simple, let's imagine that there are three people on a job site, and they all have their own individual jobs to do in order for this project to get done correctly and on time. However, if one of them were to get sick, the other two need to pick up the slack and do the sick guy's job. Otherwise, that project will fall behind schedule and nobody's going to get paid. Now imagine that those three folks have names, and their names are vestibular, proprioception, and vision. So without telling you exactly how all these systems work together, all you need to know is that when one system is faulty, the other two can now compensate for the weakest link in the chain, and the project ends up getting done and everyone gets paid. Like I said before, rehabilitation is always my number one goal, but compensation can be useful when, let's say, the vestibular system, as an example, cannot be restored or improved through rehabilitative measures for whatever reason. These exercises are aimed at teaching the brain to rely on other sensory systems in order to compensate for that faulty one. Now, lastly, habituation. That's our third and final option, at least in the world of non-invasive measures. Habituation involves exposing individuals to stimuli that trigger their symptoms in a safe and controlled environment. The goal of habituation is to reduce the intensity and the frequency of these symptoms over time by desensitizing that system to the stimuli that triggers their symptom. For example, this will often be utilized for patients who struggle with visual motion sensitivity. Let's say that when you're exposed to visually moving objects or crazy patterns, it makes you really dizzy. The idea behind habituation is to just expose you to that stimulus until you become tolerant of the stimulus and it no longer triggers any symptoms. Patients typically feel terrible when they have to do this, and so if you're a patient and you're currently undergoing vestibular rehab or at least some sort of rehab, and your provider is utilizing habituation methods, I would want to know if we have exhausted all other options to get us to this point. And not only just because you're going to feel terrible doing it, but my personal opinion, and I feel like most would agree with me, but I always want to strive towards fixing whatever may be impaired at the most fundamental level, not just patching up things for a little while. With all that being said, a skilled provider should be able to assess an individual's need and tailor a treatment plan that incorporates whatever combination of these three options in order to achieve the best possible outcomes for you.